Hi, this is Dr. Kaan at the ACL Academy, and today I'm going to show you a cheat code, a way to make your leg extensions or your knee extensions when you're doing your isolated quad work after ACL surgery a little bit more comfortable. Before I do that, guys, if you've been following along, found value in the channel, please subscribe to it. Please also share with a fellow ACLer. And as always, any questions or comments, leave them below. We get to every single one. So what I'm going to chat on a little bit is the particular exercise that I love during this rehab process, and that's the leg extension. And we do this early on. And the reason we do this early on is the quad focus is one of the most important pieces to really hone in on early on after surgery. You want to get the quad muscle going early. You want to get it activated because this group of muscles rather, takes the biggest hit. Now, a common complaint that I get when doing this particular exercise is sometimes a feeling of like stuckness or catching, particularly like in the front of the knee, okay, like surrounding the kneecap area. When a person goes from flexion to extension, bending, or straightening, sometimes they feel like something gets stuck or caught. And when we load it with weight, you may feel that feeling a little bit more. Now, most cases, what this usually is the kneecap itself. In order for the knee to go from bending to straightening, the kneecap has to glide up and down. For example, when I go into a straight position, right, when I go from flex to straight, the kneecap glides up towards the hip, and then when I bend my knee, the kneecap has to glide downward. After the surgery or after an injury, sometimes the tissue surrounding the kneecap can become bound down, and this may limit the mobility of the kneecap. So what we do to combat this is we'll do mobilizations, like manual, using our hand. We'll mobilize the kneecap itself, and I have some videos speaking on that. But particularly when I'm trying to do this exercise, which is very, very important, the knee extension type exercise, right, as this focuses solely on the quads, well, when I get that complaint that it's hard to do the exercise because something is catching, there is a little thing that you can do that will make this exercise very, very convenient, very easy, and feel much better, and actually engage the kneecap the way it should, and help it track in and out of the groove the way it should. So very, very simple. When you're starting this exercise, you may start it with no weight, right? Early on after the surgery, we will do this exercise maybe in a partial range like this. Let me move back a little bit so you can see me. So we're at 90 degrees here. We may start working from 90 to 45, or if it's too hard to do that, I may encourage using the other leg to assist, right? So we start this early on in the process just so we can get moving and feeling the proper movements. So the knee can feel the proper movement, the quad can start getting engaged, and then eventually you'll move on to full range where you're working from 90 to about 0. And again, we would do this against gravity. Eventually, we'd add some ankle weights and then build you, past 10 pounds so we can get you on the leg extension machine. But as I said, sometimes that complaint is when you are moving the knee, there's some irritation here, or some catching here, or some locking, people describe it as. Well, a very simple trick is you would take your hand, right, and you would cup it over the kneecap. So very easy to find, like the surrounding of your kneecap, the bottom, the top, the two sides. So you could kind of put your hand right over. If you make a little cup with your hand like this, you can cup the kneecap itself. Now what you're going to do is you're going to help the proper glide. Meaning, when I go into extension, I'm going to traction my kneecap up. And then when I go into flexion or bending, I'm going to push down, right? So I'm encouraging the proper glide. So up to pull up, and then push down on the top of the kneecap to glide it down. So when I go down, I'm using the palm of my hand here, the palm surface. And when I'm pulling up, I'm using my fingertips. So that's why the cupping motion works perfectly. So again, we pull up as I'm going to extension, because the kneecap glides up towards the hip, and then I kind of push down with the heel of my hand to glide the kneecap down. As I go into bending and flexion, the kneecap has to glide down towards the feet. So this you can incorporate throughout this exercise. And when it's loaded, meaning when I start putting an ankle weight on it, that you may feel those symptoms even more. So that's why you can do this throughout the process as you load weight, and even as you get to the knee extension machine, because you're not necessarily like assisting with your hands. All we're really doing is letting the kneecap go through its groove or its tunnel, right? So we're helping the proper movement. And a lot of times, the more repetitively we do this, we call this immobilization with movement, right? The more that we do this, the more we kind of reteach the kneecap the proper movement, right? So this way, those symptoms of catching and locking happen less and less. So as you can see, as I'm going up, I'm pulling up. As I'm going down, I'm pushing down. And it's very smooth, right? So, and again, you can do this early on after the process, really first week or so. I encourage it. And as we're doing it more and more, this is an exercise that I use as a staple, you'll eventually won't have to have your hand here. But it is a great, great way to, as I said, help with some of those symptoms of locking or catching that you're feeling, that it's most likely the kneecap. And it helps the kneecap run properly in its groove when you're going to bending and extension. So it's a great little trick, little cheat code that I like to use with our clients if they're getting these types of symptoms. And it's something that you can utilize right away. So I hope that was helpful, guys. If you have some questions, comments, leave them below. If you found some value out of this video, please like it, please subscribe to our channel, and more importantly, share with a fellow ACL that can benefit from these videos. I will see you guys next week.